You brought up some evidence that you've talked about quite a bit that in this interview already, but I want to go back to it because I think it's explosive, it's big, it's both shocking and amazing and maybe to be expected, which is this thing about how you found through many, many studies that essentially, am I right, that the more advanced your civilization is, in quotes, right, the less likely you are to recover from things like schizophrenia. the more likely you're probably even to be diagnosed with them, but also that the treatment that it's going to be less likely that you'll get out of it, right?
Right.
That's what you found over and over again. So that you said that
Right.
even in rural areas in places like Brazil, they have higher recovery rates than in places like New York City.
Oh, absolutely. And listen, the best recovery, by the way, and here's an important thing. The diagnosis in the World Health Organization studies were being done by Western doctors. So they were identifying the same sort of, group of symptoms in people. It wasn't a meaning of it was being applied differently. And yeah, the best outcomes that were in rural India where no one was placed on the drugs or kept on the drugs. And that's the big thing. In Nigeria and in India, they might have used antipsychotics acutely, for when there were some people in a psychotic episode, but they didn't maintain people
right
on the drug.
Right.
That was the difference. And then when they went back 15, 20 years later, first of all, so many of them were asymptomatic. They had a time of schizophrenia or a time of psychosis. But my favorite story is when they went back 15 and 20 years later to talk to the people who'd been in that study in the various countries. And in the developed world, in the US, people were sitting around in group homes and stuff and not doing anything, getting fat and that sort of thing, because they were maintained on these medications. But when they went to India, the people said, okay, listen, I can give you an hour of time, but I can't give you any more hour of time because I got to be working in the fields. So it was a totally different, outcome. I mean, they just said the course was so different. I had a good friend who was from Cameroon, and he was from the tribal family, the leaders of that tribe. Okay, and one of the things he did is he worked with, quote, the curers of the sickhead in that tribal community, and he talked about how they had a parade each year, and the people who were seen as struggling led the parade. And they talked about one woman in the community who we would call her crazy, but she had a soup stand and, whatever she did was crazy, was okay. The point is, it's not that there isn't in these rural societies diversity of behaviors, diversity of, struggles, et cetera. It's within the more within the spectrum of what is seen as the human spectrum.
Right.
People are weird.
Right.
People are different, and people are eccentric.
And one drug does not fit all.
Yeah, one drug doesn't fit all. But the other thing is what you're getting at here, Thans. The research on, say, antipsychotics long term. Antipsychotics are meant to change you. They're meant to change how you experience the world. They change your brain physiologically. And the research shows that on the whole, that change is not. It very much diminishes your chance that you'll get a regular life back or any sort of decent life back. And we just had a study 2 months ago. It's the best long-term study ever done by Martin Harrow and Thomas Job in the United States, funded by the NIMH. And they concluded that if you're on medication, you have 1/6 the chance of being in recovery as those off medication. Or to put it opposite, those off medications were 6 times more likely to be recovered. And their version of recovery meant working or in school half time. And you know what they found? Now, this was a study where they began following people out of 2 Chicago area hospitals, late 70s, early 1980s. Everybody's treated conventionally in the hospital, they're discharged, and now they just follow them. And what they found is the people who left care, who left psychiatry, often psychotic when they exited, they were the ones that had the best outcomes because over time they quit taking their medication, and a high percentage of them got stable and were able to return to a working life, a social life.
You're talking about psychotic people.
I'm talking about people diagnosed with schizophrenia.
Schizophrenics. You're saying that a major study, and this comports with other studies as well, right? That
Yeah,
People who do not take treatment are 6 times more likely to what? To become functional?
yeah, to be in recovery, and to be in recovery was asymptomatic, stable, and have a decent level of functioning, as measured by working or in school half time and some social friendships. Yeah, 6 times more likely to be in recovery. And by
That's
the way, it's not just any study. This was the study that the NIMH funded to figure out what happened to people long term. And listen to this. You know what Martin Harrow told the American Psychiatric Association in 2008? He said this, reporting at the National Annual Conference. I conclude that people diagnosed with schizophrenia off medication have significantly better global outcomes over the long term. That was his finding. Now, there's been other studies now that basically from, there was a Norwegian study, we've had a German study from other countries that are finding, indeed, it's the people who get off their medications that are more likely to be in recovery. And surveys of people so medicated, you know, you're diagnosed with schizophrenia or diagnosed with psychotic disorder. If you survey those people, here's what the surveys have found. People will say, you know, maybe I needed those drugs for a time, but after a while, they were a hindrance to my recovery because I couldn't bring my full emotional engagement, my full mind, my full cognitive abilities to remaking my life. So if you're going to honor the voice of those so diagnosed, you have to incorporate that data into your understanding of how can we as a society best help people who get this diagnosis, et cetera.